Knock, knock, knock. Performing hand hygiene as I walk through the room or walk into the room. Hi, how are you today? Good. That's good. I'm Rebecca. I'm going to be the student nurse working with you. Before we begin, I am just going to pull this privacy curtain. All right, perfect. Now, can you state your first and last name and your date of birth for me?
Kathy Alvey, 3'9".
All right, and are there any allergies I should be aware of?
No.
Okay. And can I just check this wristband? Awesome. Now before we begin, the physician ordered you to get some TED hose. Those just help with compressing your leg and reducing swelling. Is that okay if I fit you and put a pair on? All right, excellent. Now before we begin, normally they would not have pants on, but we are what we are. And I would make sure that they are comfortable in bed if they were laying down and that the rail of the bed was down. However, for her, she's already sitting up in a chair, so I don't have to worry about that. And to begin, I am going to just check for any lesions, wounds, or redness that we should be concerned about before I do this. All right, and everything looks good. So from here, I'm going to go and I'm going to wash your leg off. I'm washing your leg off. I'm drying your leg off. I'm drying your leg off. And now from here, I am going to measure your calf, and then I'm going to measure your heel to your popliteal space in order to get the correct fit for your TED hose. Does that sound okay? All right, so measured, and I measured. All right, now normally you would use those measurements to get the proper fit on the back of a TED hose packaging or on the measuring sheet. However, since we are in these circumstances, I just know that and I'm just verbalizing it, and we're just going to use a pair of socks today. Now there are multiple ways you can put on TED hose. I personally like to go in, I like to grab the heel and bring the top half down and then bunch this up, and I like to put it in like this, making sure I really smooth out the foot. And since this is so tight, I like to really make sure that this is all good and that to begin I already have some room in the toes, and then all I have to do is gently pull the rest of the TED hose up. Once again, once I have it all the way up, I'm checking the room in the toes, and normally the toes would be open so that way you can do your assessments, but like I said, we're using socks, so it's not the case. However, you also want to make sure that the TED hose are nice and smooth, there aren't any wrinkles, and that there's a proper fit. And then from there, the patient is good to go, and I would repeat it on the other leg, washing, checking the leg for any lesions, and then put this on once again, grabbing the heel, inside out, putting this on, checking for room for the toes, pulling this up. Once again, checking room for the toes, making sure there's no creases and that this is nice and smooth. And then from there, the patient is all done with getting fitted for the TED hose, and I would make sure that they're comfortable, that they have their call bell, everything they need. But before I would do any of that, after I fit them for the TED hose and put the TED hose on, I would make sure to remove my gloves, perform hand hygiene, put the bed rail up, give them their call bell, or if they're sitting up, I would put their tray in front of them and hand them their call bell, making sure they have everything they need, and then perform hand hygiene on my way out of the room.